Hello, and welcome to another Profiles of Endurance. I'm Father Scott Vanderveer. Many of us have been watching stories about coronavirus and COVID-19 on the news, and we have been overwhelmed with scenes of patients on ventilators, with multiple organ failure, dealing with life and death with almost no notice at all. For most of us, those are news stories, but not for Erin Hegarty Snyder, who has been working as an ER nurse for many years at a Buffalo hospital. But when she found out that her healthcare facility, St. Joseph's in Buffalo, was converting to an all COVID-19 hospital, she wound up having some very important choices to make. Would she go into a facility that was only for COVID-19 patients, especially early in this pandemic when we knew even less about it than we know now? How has she handled that with her faith and with her family? Erin is here with us today to talk about that. And Erin, we're so grateful that you took the time to be here. And let's start at the beginning because I think that'll help us get to know you and what led you to where you are now. Talk to us about your family life and your faith life growing up. What was that like as a little girl?
Family life, I was raised an only child in Rochester, New York. I was born in 1979, so late 70s, kid of the 80s. My father has a very large family. He is one of six. My mother is one of five. So lots of aunts and uncles, grandparents around, good family support. Raised Catholic. I actually went to St. John the Evangelist School from kindergarten through second grade. Living in Rochester prior to moving to Buffalo, where I started public school in third grade. But, it was pretty routine. Regular, nothing super exciting and out of the ordinary. But church life, we were not every Sunday churchgoers, truth be told. Celebrated all the holidays, though. My grandmother, very, very active in the church. She sings in the choir, so I used to spend Holy Week with her every year for Easter. I'd be on Easter break, and I would go just stay at her house. So, I was very much into church, especially for Holy Week, and would go to all the masses with her and everything. But, God's always been a part of my life, always been a big part of my life. I just wasn't one to formally go to church. Yeah. But my relationship with him has been very solid and strong throughout.
Yeah, beautiful. When you were a young girl and you were thinking about what your future was like, what did you think about becoming when you grew up?
I only ever wanted to be a nurse.
Really?
Honest God. My great aunt was a babysitter, and I was very blessed to be able to go over there. So she kind of helped raise me. And she had several kids and had like a daycare out of her house, and we used to play all the time, and we played school. I was never the teacher. I was never the student. I was always the school nurse. So, it was really, even when I was a little girl, I just loved taking care of people and helping people.
Was there ever a time that you were afraid of some of the stuff that nurses see? Were you ever afraid of blood or anything like that?
No. Honestly not. My husband gets grossed out. I watch a lot of gory stuff on YouTube that he really would rather I don't watch. Medical procedures and stuff. I'm like, oh, look at this. He's like, no, it's gross. I really don't get bothered by much.
Wow. So you went through high school, and the plan was, I'm going to go to nursing school?
I went to SUNY Brockport, and I was always a very good kid in my younger years and in high school, and let's just call me a little bit of a late bloomer. I got involved in a sorority and had a lot of fun. My major was nursing, and my minor was journalism, but I pretty much ended up majoring in beer pong and minoring in socialization. So my parents kind of gave me an ultimatum and said either I turn my minor, which was journalism, into a major, or I come home and I go to nursing school at home.
Ah.
So I came home and I went to Trocare College in Buffalo.
Wow.
And I got my associate's degree in nursing there. And then I later ended up getting my bachelor's in nursing from Niagara University.
Oh, how wonderful. How wonderful. So, and of course, Niagara is a Catholic school.
Yeah, so was Trocare. I needed nuns to straighten me out.
That's right. Trocare is too.
Yeah.
Wow. So that, and you did, when you got there, your focus returned. And
absolutely. Yeah.
Wow.
Without question. Yeah.
How wonderful. How wonderful. So you graduated. What year did you graduate from college?
I graduated became an actual nurse from Trocare in 2003. And honestly, I don't remember the year I graduated at Niagara. I was at, I want to say maybe 2012, 2013. When I got a job at Catholic Health, they had like a cohort program with Niagara University. So actually my education was paid for by Catholic Health in Buffalo. That
is wonderful to hear.
Yeah,
but it also
amazing.
It causes us to tip a hat to you, because it means you got that degree while you were working.
Yeah.
Were you full-time nursing when you were also finishing your degree?
I was, yeah, it sure was.
How the heck did you do it?
Carefully. Yeah. Well, we had a lot of support. So they really, going from an associate's degree to a bachelor's degree, it's a lot of just kind of paperwork and projects. It was no really new applied nursing knowledge. Mm-hmm. Mm-hmm. So it wasn't too terribly difficult to do.
What was your first nursing job when you got out of Trocare?
I got a job at Greenfield Health and Rehab Center. I was a nurse's aide there when I was in school at Trocare, and then they hired me on as a nurse. So I started there as a floor nurse, and then I became a nursing supervisor there.
Wow.
And it's like a subacute rehab. So they had rehabilitation, and then it was a skilled nursing facility. So just typical nursing home patients where the residents were there and they lived there. But you could really only do so much there, and I was still a pretty young nurse, so it kind of got boring.
Sure. And you've gone on to a nursing career in the emergency room, which is the opposite of boring.
Oh, yeah, that's exciting. So, yeah, I got a job at St. Joe's in Cheektowaga, New York, which was a part of Catholic Health, and that was in like 2008, and I worked on the floor, a medical surgical floor, for about 10 years, and I, again, got a little stagnant there. And that's the beauty of nursing. There's a bunch of different subspecialties that you can just sort of bounce around into. So if you feel like you're getting stagnant, you can, find something new and refreshing. So yeah, I went down to the emergency room, and it was a fit. I love it.
Oh, it really fits you well. What do you like about it?
It's very fast paced. You never know what you're going to expect. Anything can walk through the door. Something can come in, and it could be something very, you think trivial, and then it could end up being something as serious as, a heart attack.
Oh, so true. So true. You also, what I would imagine is you are dealing with not just the patient in a state, they're in an emergency state, it's the emergency department, but any loved one that is with them is probably pretty close to a boiling point with panic.
For the most part, especially, you find that a lot when children come in. My hospital is an adult hospital, but we still do have parents bring their children in. And we try to do the best we can, but, 9 times out of 10, unless it's something simple or routine as like an ear infection or whatever, we are shipping them over to Children's Hospital in Buffalo.
Now, you have said that nursing was the thing you always wanted to do. It was from the earliest age. You wanted to play school nurse. You have described nursing as a calling in your life. What do you mean by that? What makes it a calling instead of a career?
It is not for the faint of heart. And I think that the only people that really succeed in nursing, you have to have a desire to help people, and under any kind of situation. And you are called to serve in many ways, and your job is to take care of the sick, and whatever that looks like. And, you just sort of have to do it. And for those of, who kind of back out and whatever, that's how you learn that wasn't their calling. That may, nursing it's a great profession.
Mm-hmm.
But the ones who really succeed in it are the ones who, and they will tell you that it is a calling, that they just have a strong desire to nurse and to care for others.
Yeah. So you had such a testing of this calling this year, because if I understand it right, you were, starting around probably the turn of the year when it became 2020, we were hearing about a virus that was very scary, but it was going on in Asia. And of course, we know, with people air travel and everything, things move around. But it sounds like it was as late as February that you were still trying to figure out what you were making of this. And you say that you were speaking with another nurse and said, this could turn into a thing.
Yeah, I said that to my boss, actually. She has gone through, she's been an emergency room nurse for I think 40 years.
Wow.
And she's like, we went through Ebola, and she's going through all these other kind of, exotic fevers and flus and viruses, and it never really fully came into fruition here in the States. And I just said to him, I don't know, I just have a feeling this is gonna turn into a thing. This is gonna be a thing. Little did I know.
Oh boy.
Yeah.
It sure is a thing. And I think it'll be interesting for us to listen to this interview in 2022 and find out, so how long did that last? How long was that in crisis? Because as we're speaking now in the summer of 2020, we, the cases right now in New York State are quite low after having an initial surge. But, they're starting to creep back up. And the states around us, other than our immediate neighbors, so much of the country right now is just exploding with new cases. And so only the listeners who are listening to this far in the future know how this turns out in a chapter down the road. But your hospital made a bold decision in March. How did that decision come about, and what did they decide to do?
Oh boy! Well, they decided to take my hospital, which was centrally located. Catholic Health has several hospitals in the Buffalo area, and they chose our hospital due to the location, due to the size, the accessibility, the services, to turn it into a COVID-only treatment facility. Wow. So it became the St. Joseph's COVID Treatment Center.
How was that announced to you as a nurse in that facility?
It was actually announced to me by a friend. It was funny because I was working that day and we were dead because, they had started to say, unless you're really super sick, don't go to an emergency room. Don't potentially expose yourself to this virus. Unless you really, 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 truly are on death's door, don't go to an emergency room. So people were listening, and people were staying home, and the census was very low. And I just said to my boss on a whim, I'm like, hey, do you think I could go home early? My husband is off, and, I just go home for the day. And she's like, yeah, sure. So I went home, hung out with my husband and my kid for a little bit, took a little nap, and I woke up to, I probably had about 30 text messages, and an announcement had been made on the news that the hospital was being changed over and converted over.
Whoa.
So everything happened very, very quickly. I mean, in hindsight, I'm sure they would have liked to have told us a little bit differently, but with everything COVID and coronavirus, time was of the essence, and they needed to get moving with stuff. So,
my goodness! All right, hit us with your first thoughts. You just wake up from a nap. You're bleary-eyed. You look at your phone. What are you thinking?
I called my friend, and she said that our boss was going to be having a meeting. I was told by my other friend, who was the charge nurse that day, that, our boss didn't even really, my nurse manager didn't even really know. That's how fast the decision had been made. And we were all a mess. I think we were all just kind of in shock. And what did this mean? What is this going to look like? What does this mean for the future of our hospital? Our hospital is a small community hospital. Will we survive this?
Oh.
Is this, turning into a COVID treatment facility? Okay, so what happens when, COVID is under control? Then what? So everyone's thinking about long-term futures. It was scary. It really was.
Oh, I can't imagine. What the days start to follow one after another. When was it revealed to you what your role might be? Because if I understand this right, a COVID facility doesn't really need an emergency room.
Yeah, we did not need an emergency room. So we were all sort of politely told that we were going to be ICU nurses.
Wow.
Because we have critical care experience, but having critical care experience doesn't mean that we're, critically care trained in the way an ICU nurse does. I mean, we like to call we fix them and ship them. So, if someone comes in a cardiac arrest, we get them back and we start them on medications and we send them off quickly to the ICU, where the ICU manages their care. And then it's their job to kind of keep them alive and further, fix them and return them to some sort of health, or at least their baseline, hopefully. But, it was terrifying. It was terrifying.
Oh.
Yeah. We were all just in shock. And we're like, how are we going to do this? How are we going to do this?
Oh. Did you consider not doing it?
Not once.
Not once?
No, not once.
What did you do with the voice of fear? What about the fear that says, this thing could take me out?
Well, this thing could take anyone in my family out. And if there wasn't someone like me taking care of someone, what's going to happen? What's going to happen if everyone gives up? That goes back to the calling of being a nurse. I mean, why say that you're going to sign up to take care of sick people and then bail when the going gets tough, Really? Like, I pictured it. I actually posted a thing on Facebook when I decided to stay, and I stayed that, I told my boss that day, I went into work for that meeting, and I said, I'm staying. I'm the Titanic or not, I'm going down with the ship. Oh. And I posted that little clip from the Titanic. I don't know if you recall when the ship is starting to sink. Oh. And there's the orchestra players, with the violin and the cellist, and they're just sitting there playing, trying to calm people in the middle of chaos.
Oh. That scene never fully meant, it was a dramatic scene. It never made its full impact until this time. Because I think we started to realize, oh my goodness, we thought we'd seen a lot in our lifetime, but we had never seen. Wow. What was the conversation like with your husband?
Before I went in for that meeting, I talked with him about it, and, he's amazing, and he just fully supported me, and he's like, whatever we have to do, we'll do. Whatever we have to do, we'll do. And he, whatever that meant with Jackson, because I said, you're probably going to have to do more of the daddy stuff, more of the stuff that I would do too. We're pretty good. I mean, he's an amazing and very active father, but we kind of break stuff up. And I said, you're probably going to have to do a lot of the heavy lifting, because I don't want to be very close to him. Ooh. And potentially expose him. I didn't know what that meant yet. I didn't know if I was going to have to move out of my house. I didn't know if they had those RVs for MDs, but it was also extended to nurses. I didn't know if I was going to be living in some trailer in my driveway, if I was going to be living in a hotel for months or weeks on end. I mean, I didn't know what life was going to look like.
Erin.
But I knew that I just couldn't not do it.
That is a calling. I think our listeners are understanding in a new way what a calling is. I mean, I'm speaking to you as a priest. I've taken vows, and, I might be looking into Airbnbs in Mexico. And this is a calling. So was there an oath or something that you took as part of the graduation ceremony that you lean on? Is there a moment where you go back to?
Flo Nightingale has a pledge. I don't even recall it right now, to be honest. But, she walked around with a lamp. So I guess I had my little lamp and was shining my light around. But, yeah, I mean, I don't know. It's just what I was supposed to do.
I think, not for nothing, but anybody who's on a first name basis with Flo Nightingale. Did you hear that, everybody? We call her Florence, but when you put enough skin in the game, you get to call her Flo.
The queen mother of nursing.
Oh, it's so true. It's so true. I really want to savor this because I think it's just a really remarkable thing for folks to hear. And I wonder, I think there are probably people listening right now with tears in their eyes because maybe they're a nurse or they're a teacher, or they have some other role that is a calling that causes them to say, yes, I do whatever it takes to help other people's kids. I do whatever it takes to be with the sick. And I mean, your son is A, adorable, and B, at the time was, 2.5.
Yeah.
So this is a major, he's your only child, and this is a pretty loving thing going on there. So you really followed the calling without wavering. It's a really powerful thing, I think, for us to hear. I'm grateful that you're sharing it. It's huge. Was there anybody in your life who didn't support your decision?
I don't think so, honestly.
Wow.
I think everyone, I feel like my family was nervous.
Yeah.
We all were kind of nervous, especially I worried about my parents. My mother has an autoimmune disease. My father has type 2 diabetes, and they help with watching Jackson when I work, when my husband and I work. So, I had to be very mindful of what that meant for them too, because I obviously did not want to bring anything home to them.
Right. Oh my goodness. So how much training did you undergo before you started the first day on a floor with patients?
That was really by the grace of God. So we got a 4-hour hit or miss basic training, ICU.
Wow.
These are the medications you're going to be seeing a lot of. This is what they do. We were dealing with things called arterial lines, which monitors blood pressure, and you can get blood off of it, but it's not something that we would normally do in the emergency room. Yet everybody had them there. More of a ventilator class. So there was probably one day of education, and then we were on the floor. So, truth be told, though, it was not. Catholic Health did an amazing job to make sure we had some outstanding ICU nurses come over from the other Catholic Health hospital sites, and we had agency nurses to come in to deal with this crisis, and the teamwork was amazing. Oh. So it was really baptism by fire, though. It was learning on the job. It's not any of that cushy, you get, 8 to 12 weeks of orientation and then you're on your own. It was really none of that. It was rough.
It was
literally wartime nursing for sure.
Wartime nursing. The image I have is you took off and then you were still building the plane as you were flying it. You had to fly it and build it at the same time.
That's how it went. They would come out and say, you're going to do this at 10 a.m., and then policy would change that afternoon. Everything was so fluid because everything kept changing. The coronavirus is new. We didn't, or the strand of it, so we didn't know what to expect. We didn't really know how to treat people. We were going off of what was happening in Italy. We were anticipating the worst. We were honestly preparing to be surrounded by death.
Oh.
And yes, death happened, but we had a lot of miracles come out of it, and we saved a lot more people than we lost.
Oh.
And I think that is an amazing credit to, the healthcare workers and to God for just giving us all the strength to get through this.
Amazing. I can only imagine, based on what you've said about your own calling, about the Flo Nightingale way of approaching things, the bond between you nurses must be amazing.
Especially the ER nurses. I mean, there were some of us that couldn't stay for health reasons, and some just decided to leave and go elsewhere. But oh my God, the ones that have stayed, because no one was asked to do anything so dramatic, as dramatic of a change as the ER nurses were to become these ICU nurses. It's a totally different type of nursing. The care is consistent. You have these patients for weeks.
Wow.
Multiple drips are running. They're on ventilators. You're proning them and flipping, 250-pound people over onto their bellies because ironically it helps them breathe better.
Wow.
It was just crazy stuff that we were doing, and we were all scared and terrified and out of our wheelhouse, and we all just did it together. So I think the bond in the emergency room nurses, the ones that stayed, is really amazing. We are family. We really are. Oh,
so moving. What is suiting up to be a nurse in a COVID-19 hospital like?
Well, I would walk in my regular scrubs, and I was given a pair of scrubs there. They had the hospital cordoned off into zones. The green zone was safe and clean. The yellow zone would be if you had to walk through on your way to what was called the red zone, which would be a patient care area.
Ooh.
So you walk into the green zone, and you were stopped at the door, and you had to have, your temperature check and a symptom check done. And we walked into this one room that had, just a bunch of scrubs. We were supplied hospital scrubs to wear for the day. So then we'd have to change into our scrubs, our hospital scrubs out of our regular clothes. And then I changed my shoes. I had COVID-only shoes that just stayed at the hospital for work. And then we had to, when you walk through the yellow zone, you had to wear a mask and gloves. And you couldn't touch anything, don't touch the walls or anything. And then suiting up to get into the red zone, we had people that would don you and help you get dressed. A lot of them were surge techs, so they're used to sterile procedure. And we would have to put a gown on, and we would have to put an N95 mask on. We would have to put a regular surgical mask on over the N95.
Wow.
We'd have to put a hair bonnet or a bouffant on, and then, our gloves. Oh, and eye goggles. We had eye shields, face shields, too.
For those who are viewing this on YouTube, we'll put a picture of that for them to be able to see. We do have a picture of that. It's just, what's the most, I imagine it's different for every person. For you, what was the most uncomfortable part of it?
I kind of had a little bit of respiratory problems myself. So it was very hard to breathe through both of those masks. That was kind of hard for me. I also have a little touch of claustrophobia, so I just had to, thank God we were very, very busy and you didn't have the opportunity to think about it.
Yeah.
So you just went in and you just got to work right away. But if you had any kind of downtime or lag time, you're just like, I can't breathe in this stuff. The masks were the most difficult for me.
I could understand. For those of us who've worn an N95 mask, and some people may have had the chance to, when I go to healthcare facilities, that's what I wear. It's a lot to wear even for a short amount of time. You really feel, whether it's true or not, your body tells you that you're not getting as much air.
Right.
And that's hard to overcome. You also came up with a really inventive way to remain human to the patients, because you looked a little bit like an astronaut, But yeah. What did you do to remain human so that somebody knew that you were someone with a face?
We were given badges. They took our regular picture off of our traditional badges and blew them up, and they were like, I don't know if they were I think they were about 4x6, and laminated them with our name on them. So when people were opening their eyes, for the first time after being in a drug-induced coma for months while on a ventilator, or weeks, and they would wake up and they would actually see what the people look like behind all the gear.
Wow, it's a very beautiful. I mean, for somebody like me who doesn't work in healthcare but works in ministry, the overlap here is just remarkable. I mean, it feels like you took a page out of the book of any kind of pastoral care manual that we would have in church, for how to be a loving presence with people in crisis. It's just a remarkable. I think I'm learning that maybe the churches need to take a page out of the healthcare book, because I'm really touched by the creativity and the kindness, and it's just remarkable. You've been speaking about some of the things that you saw, people in a drug induced coma so that they could breathe on a ventilator. This is for some of us, this might be new to actually hearing actual stories about coronavirus from somebody that could live down the street from them. Here in our parishes, during the height of coronavirus, from March until mid-May, I as a priest celebrated 8 funerals for folks who passed away from COVID-19, and that most of them were older. I would say that the youngest was in their upper 60s, and then I would say the median age was probably upper 80s, lower 90s. But they were terrible losses for us. What kind of things did you see patients going through in the hospital?
Well, initially when it started, like I said, our protocol had changed, and the way we were treating people had changed as we learned more, because with the coronavirus being so new, everything, we were just taking things from Italy and in Asia and just kind of trying to build off of that. And as things didn't work, we would change our protocol and our policy and how we were treating these people. Initially, they were saying that early intubation, which meant putting them on a ventilator, was their best chance of survival. However, once they are put on a ventilator, it's hard to get them off of a ventilator. So it was very much a gray area. Initially, we were treating with the Plaquenil and the azithromycin. That we did early on, and we learned we really weren't having any kind of benefits, and the Plaquenil was also giving people arrhythmias. So we had stopped using that. We had very good luck with a medication called Remdesivir. I believe I'm pronouncing that correctly. It is a medication that's like a suppressant that is used usually, I think, for people with arthritis. So we were doing different things to get people going, but I mean, it's a hard thing. Like, the drug of choice when someone is sedated, we would put them on propofol, and that would keep them unconscious, but then that would tank their blood pressure. So then you would have to put them on a medication called Levophed, which would help bring their blood pressure up. However, if you're keeping someone on a medication like Levophed for an extended period of time, it pushes the blood supply to the vital organs. So then your extremities were not getting blood flow. And, we had patients that lost toes because of blood flow, but, what was more important at that time, the more important thing was keeping their blood pressure going so they could stay alive.
That's right.
So, I mean, they were on ridiculous amounts of medications, multiple medications for pain, fentanyl. They were on medications, for SED to help with the sedation and anxiety, because obviously, it's if you're not fully sedated and you have a tube down your throat, you're obviously going to be anxious and wanting to grab and pull. There was just a lot of stuff. We were doing the proning. The proning was working very well for many people, and that meant turning them onto their belly, which would increase their surface area of their lungs and promote lung expansion. So we would have people, if they could, as long as they could tolerate it, but we would try to have them on their bellies for 16 hours a day and then flip them over. But these people are literally dead weight because they are unconscious and they're, sedated and they're paralyzed. They had to be paralyzed when they were on their belly. So, I mean, it was quite the production.
I can't imagine. And people of all sizes and nurses of all sizes and strengths trying to do this.
Yeah, it would take probably about 6 or 7 people to flip someone.
My goodness. What were you experiencing about the age ranges of folks?
Middle-aged, I would say. I mean, a lot of, Unfortunately, I have two patients that did pass away, but one was a 37-year-old mother of four. One was a 41-year-old father of a 5-year-old little boy, and those kind of stuck with me because they were so young.
Whoa.
The majority of people were my parents' age, which kind of freaked me out.
Yes.
So probably like mid-60s.
Wow.
It's anywhere from mid-50s to mid-70s were the majority of people. And that was just the ICU. I don't really know what happened on the floors, like
Sure.
on the regular medical floor. The age range is up there. A lot of times they had a lot of the older people come in from the nursing homes, the geriatric patients that are in their 80s and 90s, and a lot of them already had a DNI order, so they did not want to be intubated. So they were, just kind of up there for comfort care until they passed, unfortunately.
Could some people survive without being intubated, or was that rare?
No, there were people that could survive without being intubated.
Wow, but it
Absolutely.
all depended.
Yeah.
One of the things that I don't want to promote any dubious science, but one of the things I do hear being talked about in the news right now, and there's listeners that might be hearing this months from now that'll find out this either was a really big lead or it was almost nothing. But it does seem like there may be a relation between people's blood types and the way that they do this too. Is that something you've heard also?
I did hear that, that people with type O had a better chance. People that were A or A positive, which ironically I am,
oh dear,
did not have a great chance of survival. I don't know enough. Quite honestly, I didn't really look enough into that. We were doing convalescent plasma, which meant harvesting plasma from someone who had already had COVID and had beaten it and had donated it to some of our patients. We were doing, I think we were part of a Mayo Clinic research study, so I don't really have results at this point to know if that was really beneficial or not. I just know that people were really, really sick for really, really long periods of time.
Wow.
I mean, really sick. Because initially we just, like I said in the beginning, we were just anticipating people being on ventilators and dying. And thank God they were not dying. And you can only be on a ventilator for a couple of weeks with a tube before we have to talk about having a trach put in.
Right.
So then there became a whole interesting, little thing there because not that you didn't want people on trachs, you do want them on trachs and you want them to have that chance of survival. However, the potential for contamination is much more if someone has a trach and they're coughing and projecting that out into the atmosphere.
Oh, certainly. Wow, the number of factors. For those of us who don't work in healthcare, it's dizzying. You start realizing, wow, it's one on top of another on top of another. Wow. Thank goodness there are people like you and others in your field who are willing to be right there with it every day. It's amazing. Now, you have emphasized that there were many more positive stories than tragedies. Thanks be to God.
Absolutely, flat out miracles.
Miracles. You saw miracles. No way to explain how certain things happened.
Correct.
And
for all intents and purposes, if anyone with any kind of medical knowledge and background were to read a case study of some of these people, you'd be like, oh, this guy's going to die. This guy's going to be dead at the end of the story. And people were maybe not walking out because we had to send them to rehab to get stronger, but they were going home to their families.
Amazing.
And it was solely by the grace of God because, we did our best medically and he took over the rest.
What a beautiful way to say you did the best you could. God, grant me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. You did what you could, and then you handed it over to God, and God did the rest.
Absolutely.
That's beautiful. It's beautiful. And your story is that St. Joseph's number of people who walked out of the COVID-19 facility is in the hundreds.
Yeah, I think, I lost track, to be honest with you. The last number I heard, I believe it was over 650.
$650 in the Buffalo area alone. That is...
And that was just from our hospital. I mean, that's not to say there are many, many hospitals in the area, so I'm sure that the number is better, but just from our little hospital alone.
So impressive. So impressive. Wow. One thing I think we should pause with for a moment, though, to just remember some of the roles that nurses and others in healthcare sometimes face. As everyone knows, family members were not able to be at the bedside of loved ones at this time for their own safety and for the safety of everyone in society, because this is such a contagious illness. One of the jobs that people in the hospital would have, it sounds like often nurses, was to hold a cell phone before a patient who was very ill so their family could talk to them. There's that's another part of this story too.
Yeah, we had one OR nurse, because everyone was kind of moved around when this became a COVID-only hospital, so everyone kind of had to find what they could do within their scope of practice. And we had an amazing OR nurse named Michelle, and she took around an iPad every day, and she would go room to room, and she would let families visit with their loved ones on ventilators. She did it on the floor. I mean, she was amazing. And I often said to her, I'm like, I do not know how you do the job that you do. And may God give you the strength to do it, because I don't know that I would have it. I really don't.
Was she able to put any words to how she was able to do it?
She said some days are better than others. And she just sort of left it at that. And I would notice sometimes, too, she would go in there and she would talk with the family a little bit and give them an update on the patient. And then she's like, I'm going to give you a little bit of private time. And she would leave the room. And I don't know if it was more to give that private time or for self-preservation on her end, because I had been in and sat in on a couple of conversations when I was providing care, and she had come in for family members to talk, and it just ripped at my soul. And I'm like, I have to leave the room. I can't be in here for this.
Cannot imagine. Just cannot imagine. Oh. How did your faith come through this? How has your faith been affected by being in the midst of something so big?
I mean, I think it's only made it that much stronger. I mean, I can't, like I said before, I mean, some of these people really had the odds stacked against them. And just to see them home with their families now, there is no other way to explain it other than a flat-out miracle. So I know that we did, like I previously said, we did what we could, but there is definitely a higher power out there that was getting them home to their family.
How beautiful. You've talked about some of the saints that you turn to as a nurse in this environment. You would pray for the intercession of saints. And the three saints you mentioned were St. Michael, St. Jude, and St. Joseph. Talk to us about why you chose those saints.
St. Jude I've always had a very close relationship with. Patron saint of hopeless causes. I was a little bit of a wayward girl for a period of time, so he has always kept me grounded. And I also I wear his medal every day. I'm actually touching it now. But my son, I had 2 miscarriages prior to giving birth to my son, and St. Jude was the saint that I prayed to every day. And I have no doubt in my mind that he kept him safe for me and helped deliver me a healthy baby boy. So I always call on him when things seem kind of dire and hopeless, which I felt like COVID was, and very terrifying. So I called on him for that. St. Michael, because I wasn't quite sure what this COVID thing was, but I'm like, this is an act of evil, because this is terrorizing people.
Felt so dark.
Very heavy. So I had a good friend of mine named Mary. She got me a St. Michael prayer card, and I have that in my visor in my car, and I say that prayer every day before I go into work. And then St. Joseph, because our hospital is St. Joseph, and who better to take care of all of us than the saints that hospital is named after.
How beautiful.
So, yeah.
Oh, what a beautiful thing. I think for me, as somebody who has not spent much time in the hospital in my entire life. I had tubes in my ears when I was a little kid, and then I had hernia surgery as an adult just last year. But if I knew that the nurses coming into the hospital were praying to St. Jude and St. Michael and St. Joseph to keep us all safe, I will never not think of that now when I'm in the hospital, how important it is to allow those saints to be invited in. That's so beautiful. It's so beautiful. What is your hope? We are now, as we speak, in the middle of summer, and as we said at the beginning, there's a real uptick going on right now in a lot of parts of our country. We're blessed to be in upstate New York, where things are still quiet, but we know from hearing about other pandemics in the past that it's very expected that there will be another wave. What kind of a response would you like to see our society offer as we go through this? We might be in, they keep telling us it's a marathon, not a sprint.
Right. It very much is a marathon. It's not going away, I mean, anytime soon. I don't think it's ever going to go away. I mean, what we can only hope is that at some point we will get it under control like we have influenza. So, we're working on getting a vaccine, which is the first step, but everybody needs to do their part. I mean, I feel like, I get it. I mean, we were all cooped up for months on end, not going anywhere, staying home, and people are sick of it. The weather is nice. You're sick of not spending time with your family or your friends. You want to be outside. You want to go shopping. You want to be at the beach and everything else, but you have to be smart and you have to be diligent, because when you get sloppy, that's when things are going to happen.
Yeah.
And, it may not affect you personally. You may be an asymptomatic carrier, and then you go to visit your grandmother, and then your grandmother gets it and she dies. Or you bring it home to your spouse or your child, and they could have very different effect, have it affected them differently than it would affect you. I mean, it's just, so many people are in the political mindset right now, and they're not really paying attention to the science behind it. I mean, hand washing works, social distancing works. Everyone complains about, what is going on in New York State, and, they're taking our rights away, and we can't even do this, and we can't even do that. But look at our rates. Our rates are low because we are, for the most part, doing that. The majority of people are doing that, whether they're forced to do that or whether they are doing it because they know it's just the right thing to do, not just for themselves and for their families, but for humanity. It's not just about the individual or the people you directly care about. What happened about caring about your neighbor?
Yes.
Do you want to risk having, I have neighbors that are in their 70s next door to me. I could not imagine. I would feel horrible if I was a carrier and got them sick because I went over to their house for dinner. You just have to be smart all the time and not let your guard down. It's
worth the diligence to save lives.
Absolutely.
Yeah, we're talking. Well, and I just am struck by, if there are nurses willing to put as much skin in the game as you and your colleagues have, what I can do as a cog in the wheel of this machine is wear my mask and keep my distance and wash my hands and not take chances. I mean, it's the least we can do for those who are really sticking their neck out. And yeah, what you said something really interesting, that this isn't going to go away. It's a great thing, I think, to compare it to the flu, because I think most of us are thinking, how long until this goes away? But it's not like any kind of new virus. That's not how it is. It's going to be among us. What do you hear being talked about among nurses? Do you guys make guesses and bets of what, how long people will wear masks, what you think is going to be really different for a long time going forward?
I think it's hard to tell. All of us are pretty much waiting with bated breath for the fall and winter coming up, because initially they were saying that it was similar to the flu, that it would follow the path of the flu, and flu season is from fall through spring. So I will be very interested in seeing what happens throughout the course of the fall and into the winter months. But I don't know. I want a vaccine that's been tested and tried and true. And, even with the flu, there's naysayers about the flu shot and whatever. I understand that too, but we know more how to deal with the flu. And, this COVID is still just so new. And like I said, we're learning new things about it every day, and we're starting to get more of a handle on it. But I don't selfishly, I don't want to have to do this again.
Yes.
I don't have, there's a truth in the saying that ignorance is bliss. I didn't know what I was walking into in March. I didn't know the kind of hell that I was going to have to go through for 2 months. And now that it's kind of, the numbers are lower and there's a bit of a reprieve, I'm terrified that I will have to do this again, because I don't know that mentally I can.
Oh.
Like, it is a lot. Like, people don't get it. I was depressed. I was flat out depressed. And, I have a girl that I actually just met. Her sister was a travel nurse, and she was in New York City, and I have no idea what she saw, but it's probably 10 times worse than what I saw, and I can't even imagine. But she ended up committing suicide in her Airbnb. Oh. Because she was so depressed and just could not snap out of it.
Yes.
And was a nurse taking care of COVID patients. And, it's not the only story. And you talk about the nurses that have died because they've gotten COVID-19, but what are the long-term effects going to be for all of us? Yeah. Is there going to be a post-traumatic stress? I've been furloughed because the census has been low. By the grace of God, thankfully, the census has been low, and I go back next week. I'm terrified to think that I'm going to have to go back into the ICU. I don't want to have to do it again.
Yes.
I don't want to. I'll do it if I have to, like I said, because that's my job, but knowing now what I would be walking into, I definitely feel like I would need therapy.
Yes.
I really do.
Yes. Yeah. That's so good for us to hear. That is so important for us to hear, because this, the cost of this is not nothing. The cost of what this does to us. Yeah. Oh, and I think, there's a lot of us in helping professions who can truly relate to this. And I think, I think and hope that what you're saying really falls on receptive ears among a lot of us. Erin, there's a few questions that I always ask at the end of one of our conversations here, and they're stock questions that people often wrestle with, and you can just give your honest response to them. But the first one is, many people live their life by a code that everything happens for a reason. That's something that a lot of people will turn to as a guiding light for them. Other people feel quite the opposite. They don't think that everything happens for a reason. Where have you been on this in your life? What do you think?
I totally believe that everything happens for a reason. I 100% believe that, and especially with all things COVID, I am not opposed to the thought that God is kind of trying to give us a little bit of a check and saying, listen, I'm going to send you guys something, and I'm going to test you. And I'm going to see, not that I'm saying that he wants people to die, but This is a check for a lot of us, because this has brought out the best in some people and it has brought out the worst in others.
Truly.
And I feel like people just need to kind of reset and get away from electronics and get away from all the other stuff and get back to families and get back to, being able to communicate. Maybe, now that you can't physically see your family, now you maybe appreciate them a little bit more. And the time that you do spend with them will mean a little bit more. And I feel like it was just kind of a hard stop. And he's like, you guys need to kind of reset and get back to basics. And I could totally be wrong on that, but I just feel like this is a good opportunity for people to do better.
Yeah. Beautiful. Which actually brings up the last question I'll ask now, What are your hopes for us as we get to the other side of the most traumatic part of coronavirus? What is your vision of this world on the other side of, if this is a test for us to be better? What does it look like?
A lot more compassion for other people and what they're doing. A lot more do unto others. Caring for your neighbor. And your family and your community. And we all need to kind of take care of each other. And I feel like that's kind of gone wayward in a lot of ways, and it's a be me me kind of society in a lot of aspects. And I think we all just need to be a little bit kinder. I feel like if Mr. Rogers was around, things would be a little bit different. I would hope anyway.
I think you're naming it. Oh, I think you're naming it. Absolutely. We were raised on better than that. Yeah, we
absolutely.
were raised on better than that. What are you doing? What will you do to endure this? You're right on the front lines, Erin. You're right on the front lines. What are you going to do to endure all this?
I just need to take it one day at a time.
Oh.
Just one day at a time.
Amen.
I hope and I pray that this does magically just go away. That would be amazing. But yeah, you got to trust that God doesn't give you any more than you can handle, and that you just take it one day at a time.
Oh my goodness. So I'd like to pause now for a second and just invite the listeners to join us with their own thoughts and reflections for a moment. What is it that you heard in this conversation that brought you a new insight you had not yet had? Was it something about the description of what this disease sounded like? Was it the idea of a calling being something that you follow, even if it leads you through danger and through something that is maybe the most depressing kind of situation you've ever been in? Did you think about how those saints, Jude and Michael and Joseph, have helped Erin through this hard time and have surrounded that hospital with blessings and protection and strength? How many miracles happened there over these months, and how many more are in store? What is it that you'd like to share with someone else from this? What hope can you speak to someone who needs it? Erin Hegarty Snyder, we are so grateful to you for being here with us. I don't know what the future holds for me, but I sure hope that the next time I find myself needing healthcare, that you are the nurse at my side. Oh my goodness, I am so grateful for your time and for all that you are doing for our listeners and for all of humanity in the work that you do. Thank you.
Thank you.
And to all of our listeners, thank you for joining us, and may God bless you all.